Problem in this country, pain pill addiction. But how do you know when you should take painkillers and when you should pass? Dr. Vijay is here with his medical opinion. Good morning.
Good morning. How are you?
I'm good. Okay, yeah, I was talking to someone who works as a therapist, and she was saying nowadays you see a lot less people with regular drug addiction, a lot more people coming in with pain pill problems. What's going on?
Well, I think it's as everything is a multifaceted problem. One, go back to your statement. I think so long as you take painkillers when you have pain and the way they're prescribed by your physician, then the risk of you getting addicted is very, very small. But the reason why it's growing is many people seem to feel that people with addictive personalities, people who are not taking this for pain specifically, they feel that prescription medications might be somehow safer or less risky to take for other purposes than actually controlling post-surgical pain or injury pain.
Okay, so but when you're taking aspirin, there's very low risk of addiction because it's not really addictive, but then you're talking about narcotics, right?
That's right. That's right. There's many different classes of medications. You got the aspirin, the Tylenol, the non-steroidal anti-inflammatory medications. Those have very low, if any, risk of getting addicted to. But when you get to more of the opioid drugs, the Percocets, anything with a narcotic portion, then the risk of addiction gets higher, especially if you're taking it not as intended.
Okay, and of course OxyContin is fairly new and has become a huge problem.
Yeah, I mean, again, it goes the same thing. When used appropriately, it's an excellent medication. For example, if you recently had surgery, or if you have severe back pain or some sort of an injury, and you're taking it for the short term and only for purposes of controlling pain, it's an excellent medication. But when you start taking it for other than that, or if you start needing it for a chronic situation, then the risk of addiction goes up significantly.
So if you have a surgery, then you should take it and then stop at a certain point?
That's right. That's right. Most of the time, the physician or the surgeon who is writing you for the medication will write it for a controlled period of time, 30 days, 60 days, very rarely 90. But if it starts to become much more of a chronic issue, then they might refer you over to a pain specialist.
Because I think a lot of people who are addicted to pain medication actually believe they are in pain when they might not actually be in pain.
That's true. That's true. That sometimes happens, and that's when it's best, and most of the time physicians will refer you to a specialist who deals with this much more often.
Now, real quickly, doctors get a hard time because people say, well, why are these doctors prescribing these addicts with pain medication? What's going on there?
Well, again, the problem is when somebody comes to you and says they're having severe pain in the back, and if you don't have any proof that says they've been to 10 other doctors looking for pain medications, and if they hadn't come to you sooner, then who's to say they're not having pain?
It's just hard to tell. You're not psychic. You can't tell if they're in pain or if they're not in pain. What is the bottom line with pain medication?
Bottom line is, if you take them when you're actually having pain, and if you take them as prescribed and as it's indicated, the risk of addiction is very low.
So they're still useful tools, but you just got to know when to just throw them away when you're not using them anymore.
That's right.
Well, thank you very much, Dr. Vijay. And of course, he's here to answer any medical question that you may have. So if you have one, shoot us an email at news@KIIITV.com, and in the subject line, write Dr.